I'm Maria Paula Henao. I go by Paula, and I'm a physician, an MD in Penn State Hershey Medical Center, and I take care of patients with conditions in allergy, asthma, and immunology. So I see a wide variety of patients in clinic. There's a combination of allergy patients with severe allergies, with severe asthma that requires higher level care, so injectable medications. And then a population of patients with diverse problems with their immune system, where basically they're unable to quickly clear infections. There's a problem with their immune system in which we call this immunodeficiency, and they're unable to properly take care of infections on their own, so need a lot of help from other sources to help them clear some of those infections. This is a fascinating series that allows people to gain further understanding into primary immunodeficiencies. And as we may know, these are, they're very rare conditions. And so it's even hard for very well-versed physicians to have a great understanding in primary immunodeficiencies. So this really gets to the nitty-gritty of providing a good, solid foundation from experts in the field to people either in the healthcare profession, in all ranges within the healthcare profession, people that are taking care of patients with immunodeficiency. And then our second layer of the series is really helping people in the community get better understanding of resources, availability, and what they can do with this condition where there really isn't that much knowledge out there, and not because the knowledge doesn't exist, but because they are rare conditions. For immunodeficiencies, because they are very complicated conditions and they're hard to talk about, and we have so many questions about it, the ECHO model really works so much better than just a pure lecture, because a lot of people that are absorbing that material really have a lot of questions and want to engage in things that are practical. So I'll give an example. If you're a primary care physician, you might have a lot of questions about, okay, well, this makes sense from, I'm listening to this lecture and this makes sense, but I have this one patient that has all of these other problems going on. How does this fit into it? What would you do? And that's what the ECHO series allows you to get to the next level in terms of being able to gain practical understanding of primary immunodeficiencies for everybody that participates in the series. It also allows people that have knowledge that would normally keep that knowledge to themselves. Sometimes we're shy or worried, and allows people to express that knowledge. So we're gaining more knowledge than just from the lecturer, but from everybody in the series that might be able to provide insightful and valuable recommendations. So this is what makes ECHO totally unique and absolutely valuable. You get new cases every week. You see like people becoming more and more engaged, asking more questions, whereas at the very beginning of the series, there might be some hesitation to ask questions. By the end, there's just robust discussion and integration in terms of being able to expand that level of knowledge. You start seeing participants being able to answer some of the questions because they've been able to integrate some of the learning and education that we do. And we know from medical education in general that the best way to learn is to teach. So here we have the participants themselves teaching other participants in elements that they've already been learning in the series and honing in those skills. So it's actually pretty wonderful to see that. There were contacts that I found extremely valuable as well as an immunologist. So there was someone, for instance, talking to us about how to go through a process of FMLA, and it was mostly geared towards how can we help patients get access to the resources that they need. But as an immunologist, that was also a really important series for me, and to be able to have a contact person that I can go to and be like, wow, this person really specializes in HR, in helping people with rare diseases access the services that they need. And so when I need those services for a patient, I have a lifeline. Some of the more expert panelists in the series on, for instance, immunology and autoimmunity became lifelines for me in terms of what do I do in certain situations that are very confusing, even for myself as an immunologist, because even if you're an expert in the field, the learning and the education and the expansion never ends. And so that's why, like, this really is an all teach, all learn. As an expert in the content of the field, I'm by no means the only person providing education, but really it's going back and forth. And that's one of the beauties of this project. Two parts of the series. The first part is the primary care and physician and providers part of the series. And the second part is a little bit more patient driven. And so for the first part, I really hope that this allows them to think about immunodeficiencies more, because it is a very hard sometimes to diagnose. Many patients go sometimes over a decade undiagnosed. And so to just think about it in a differential, if I've been able to allow people to get a little bit closer to that, that's a mission accomplished. To refer early, to find resources in terms of like finding resources in the Immunodeficiency Foundation or through us. So that's like the hope that I would get some people to start thinking and knowing a little bit more about these rare diseases and reaching out for help when they need it. In terms of the patient, I hope that this provides them with empowerment and an ability to seek help in the ways that they need it to better control their illness.